What social distancing means is that we are going to establish essentially a perimeter around ourselves. The recommendation right now that we see is 6 feet, and really what that comes down to is that is the distance where we see a lot of the particles that are expelled when someone coughs or sneezes. A lot of those large particles, which really are the infection risk with person-to-person transmission, a lot of those will fall out of the air within that 6-foot distance. It's unlikely that we're going to cough and have something land on someone at a distance greater than that. So when we're talking about a disease that's spread through the respiratory route, that's spread because people are coughing, it's important that we eliminate the risk of people coughing on each other and allowing those particles that are suspended in the air for a short time to actually land on each other. So that's why this social distancing strategy is important, and that we keep ourselves physically separated from those that might be ill or contagious. So we've seen a lot of recommendations. First it was groups no more than 50, now we see groups no more than 10, and maybe we see recommendations for no social gatherings above even smaller numbers than that. Really the key here is that we have to break the chain of transmission. This infection is passing from person to person to person, and so that the more that we congregate, the more interaction we have with each other, the more this infection is going to be transmitted in the population. So we really have to reduce the number of social contacts that we have. The best way to do that is reduce our interaction with each other. Ideally, we should not be gathering in groups really any larger than what we must, and that's often our family. It's hard for us to distance ourselves from our children or our spouses, but we should not be going to the movie right now. We should not be gathering for large parties, because those are the types of environments that allow this infection to continue to spread. And the sooner we're able to break the chain of transmission, the sooner we're able to drop the number of transmission events that are occurring in the population, or prevent those from ever occurring, the sooner we can move past this. Is it safe to go outside? Absolutely. In fact, I would encourage people to get out, go on a walk, enjoy the sun. The sun helps our immune system. Exercise helps our immune system, helps us be healthy. And it's important that we maintain our physical health, our mental and emotional health as well. And so being outside at an appropriate distance away from each other and not in a crowd, I think is really important for people right now. And so I would encourage people to get out, walk the dog, go on a walk around the block, get out and enjoy the New Mexico weather. But really we need to avoid being together in groups right now, and so that we can control the rate of spread of the infection and hopefully not allow it to reach levels that become really challenging for our healthcare system to deal with. So this term flattening the curve, what this refers to is when you look at the curve of infections in a population, if the infection is allowed to spread through a population unabated, what you get is a very, very steep curve where you have a lot of cases that occur very quickly. And that can very quickly overwhelm our healthcare system. Our hospitals run out of beds, they run out of ICU beds, they run out of ventilators, because there are simply too many people infected in a population to be able to deal with that. Flattening the curve means that we're going to take those same number of infections, but spread out the rate of infection, spread out the number of infections that will occur over a longer period of time, but the number of infections in the population at any given time fall below the limits of what our healthcare system and our hospitals specifically can manage in their ICU beds. And so flattening the curve simply refers to taking those number of infections, spreading them out over that longer period of time, and so our hospitals can keep up.